Hi, everybody. Thanks for joining us. I'm Sarah Harlock. I'm the program director for the Integrative Center for Memory at Dent Neurologic Institute. Today, we're going to be talking about a conference that I had the privilege of attending back in July. It was the Alzheimer's Association's International Conference, and it was fantastic. As I said, was the middle of July. There were over 6,000 people who had attended this conference, and they were represented about 70 different countries. And so researchers from all around the world were sharing their information, and it was just a very exciting energy and so on. Very inspiring to be around so many people who have such passion and are working so hard to try and find answers and cures for Alzheimer's disease and dementia. So it was a really great conference. And a lot of really good information came out of it. You may have heard some of it on the news already, because I know it did hit mainstream media. But we're going to talk about some of the information. And specifically, there were different types of presentations made as well. So there were hundreds of poster presentations. This is where people present their research and are happy to talk to you about what they've learned and what they studied and so on. There were also panel discussions where you'd hear multiple people discussing the same issue, and then plenary sessions, which were more like lectures and so on. It was really a terrific way to get information in a lot of different ways. So some of the most exciting information that came out of the conference was really around lifestyle. And so that's what we're going to talk about today. Are these lifestyle factors that can impact people's risk of developing cognitive impairment, and what the researchers really were able to discover. One of the studies that was talked about very frequently was called the FINGER study. So this was a program out of Finland, and they did a 2-year study and looked at lifestyle factors. And this was the first randomized controlled trial that proved that these lifestyle factors can prevent cognitive decline. So very exciting news. And it is actually, the study was so successful that they have now initiated something called the Worldwide FINGER Study. And there are about 10 countries that have signed up to sort of replicate the FINGER study in their own country, so that we can see how this kind of information and these lifestyle factors work in different parts of the world. So in the US, we have something called the Pointer Study, and so that will be starting soon. And it is operating out of specific universities in California, North Carolina, Texas, and Illinois. It's a 2-year study, and I'm not sure if they've started recruiting for it yet, but if they haven't, they will be shortly, and getting themselves organized to run this. And I look forward to hearing more from the Pointer study. I think we're going to see some really interesting data come out of that. Along those lines, there are other researchers certainly that were presenting at this conference, and what they were talking about are what we call modifiable risk factors. And these are things that we can change. So as opposed to our genes, which we can't change, these are modifiable, meaning we have the ability to control some of this. And these modifiable risk factors include smoking, depression, physical activity, social stimulation or social isolation, diabetes, and diet. And so these are all things that we have some control over, and they have a really big impact on the risk of developing cognitive impairment. And so it's really important that we address these factors, and so that we are reducing our risk. One of the more challenging things about research is that one week you can hear a report that sounds great and very positive results and all the rest of it, and then a week later, you might actually hear a report that says the exact opposite. And so this, in fact, did happen at this conference. We had 2 studies that both showed that lifestyle factors, both studies were looking at lifestyle factors. One of them showed that people who were in the genetic high risk group, meaning that they have a gene that puts them at a higher risk for developing Alzheimer's disease, were able to reduce their risk of developing cognitive decline using these lifestyle elements. Another study showed that lifestyle factors didn't affect the risk of developing cognitive decline for this same high risk genetic group. And so people have now taken those two studies and sort of teased out why there might be such differences and why we can get conflicting results in these kinds of studies. And it turns out that between these two studies, the ages that they were looking at were different. The way they defined genetic risk was different. The way they actually measured cognitive impairment was different. They weren't using the same assessment tools. And the length of time that they were actually following the subjects was different too, by several years. So whenever you're hearing research reports and so on, it is hard to sort of tease out what is what's really concrete, what we know, and then what other reports might be saying, and how to handle some of that conflicting information that we get and so on. It can be difficult, but I can tell you that here we will be trying to give you the most accurate and up-to-date information and give you more research updates as the year progresses and so on. There's a tremendous amount of research being done, and it is a very exciting time. And again, this lifestyle information that we're hearing about is part of that big excitement that there really are things that are within our control that can impact our risk of developing any kind of cognitive impairment or reducing our risk. So these modifiable risk factors and so on are really very important and probably not really news to a lot of people. We've known for a long time that smoking is not good for us. It's not good for our heart, and what's good for our heart is good for our head. So likewise, if we're doing something that's not good for our heart, it makes sense that it would negatively impact our brain as well. And so again, physical activity, social isolation, we're going to sort of tease out some of this now and sort of look at some of the subjects or sort of the studies that specifically addressed these lifestyle choices. So exercise is one of these elements that has been studied. I mean, the amount of study that's been done on exercise is tremendous. And one of the studies that they talked about was called the Intense Physical Activity and Cognition Study. And what this study found was that intense exercise is actually more beneficial to you than moderate or light exercise. Now, I'm just going to say that any exercise is better than no exercise, but what this study really showed was that having a exercise that was more intense, that got your heart rate up and so on, had a more protective effect than people who just sort of went for a stroll or did some light exercise. So that's something to keep in mind. Another study that was talked about was the Fitness for the Aging Brain study. And this one was interesting. They put people through an exercise program, and then they measured their cognition at 6 months, 12 months, and 18 months. And it showed that there was a positive effect on their cognition. What was really interesting was that they then tried to follow up with people 10 years later. And so obviously they weren't able to reach everybody in that study, but they were able to reach some. And when they looked at the data, they found that there wasn't so much a cognitive benefit, but there was a very significant benefit in the reduction of falls. So the people who were in the exercise program were falling at a much, much lower rate, or their risk of falls was much, much lower than the non-exercisers. So again, you know, benefits that go beyond cognition as well can be attributed to exercise. So really important that we're looking at exercise. I'm going to talk about diet very briefly. The reality is that there wasn't any single diet that was identified as the solution or the answer. And so every country and region has its own access to foods and so on. So there wasn't any one diet. Basically, they were saying a healthy diet. And I always suggest that if you have questions about what a healthy diet is, that you contact your health insurance company and ask for information or talk to your primary care. It's really very individualized based on your own unique needs and any other conditions that you might have. So it's tough to say there's one diet that would be completely appropriate. They weren't identifying any single superfood or anything like that. Again, it was the idea of a healthy diet. So if you need help with that, identifying a healthy diet, talk to your doctor or talk to your health insurance company to get some information, or maybe a referral to a dietitian. Sleep was another really hot topic at the conference, and it was identified as being very important to memory and cognition. There are specific brainwave activities that occur during sleep that help the hippocampus. That's the part of the brain that's responsible for short-term memory. There are specific brainwave activities that happen during sleep that encode information that's gained during the day. So if there's disruption to your sleep, there's an opportunity then for the process of encoding or remembering or storing this information and memory to be disrupted. And so again, sleep just becomes absolutely critical. We know that amyloid plays a role in Alzheimer's disease, and what studies are showing is that people need 7 to 8 hours of sleep a night in order to avoid this sort of amyloid deposit or amyloid buildup in the brain. And so this idea that older people don't need as much sleep is not really true. So we need to make sure that people are getting an adequate amount of sleep. Insomnia is certainly an issue that can affect the amount of sleep that people are getting during the day. And it was determined that insomnia can increase your risk of developing Alzheimer's disease. Menopausal women are at a higher risk of insomnia than men of the same age. And so they were identifying this as possibly or potentially one of the reasons that more women are developing Alzheimer's disease than men. It might not be the only answer, but they do think that that might be part of the reason why the statistics are different between men and women. Sleep apnea is also another issue that increases the risk of Alzheimer's disease, but also some cardiovascular issues too. So again, if people are having difficulty with their sleep, it's really important that you're getting some attention or putting some attention on this and doing what you can to try and make sure you're getting good sleep. And some of that's activity during the daytime, making sure that you're out in natural light, trying not to nap too much during the day, making sure that you reduce the amount of time you're staring at a screen shortly before bed. You know, they're watching your caffeine intake and your fluid intakes, things like that, certainly can help with your sleep hygiene and so on. But if you're having trouble, I encourage you to talk to your doctor about it. There may be some other steps that can be taken as well. And if sleep apnea is the issue, then perhaps a sleep study is warranted. So mental and social stimulation is another component that's part of the finger study and part of these modifiable risk factors that were talked about at the conference. And the mental stimulation, they talk about formal education, but beyond formal education, there's lifelong learning that we can be doing that will help assist us with building up these brain reserves and can be really, really beneficial. And so, engaging the brain. Uh, it's not uncommon to like watching some television shows and so on. That can be educational if you're watching certain programs, but you need to be doing more for your brain than that. And so finding those activities that you find enjoyable and that challenge your brain, that make you think about things in a new way, are all really helpful. Learning new instruments, learning a new language, all of those kinds of things can be very good exercise for the brain. So the social stimulation is another piece of this that is really very critical. And so as people age, it's not uncommon for us to see them become a little more isolated. They may have their own mobility issues. So maybe they've got hip pain or knee pain that's stopping them from exercising with the group at the gym. Or perhaps it's that they don't have transportation. They don't like to drive at night anymore, and so they're not able to go out to the BPO and enjoy the concerts and so on like they used to. So you can see that people sort of gradually start to isolate or limit their social encounters and so on. But we know that social stimulation is critically important. And so it's important that we look at why somebody might be isolating and how do we overcome some of those issues. And not all of these things have to happen in isolation either. So our social activity can happen at an exercise program. Our exercise can happen as we're walking to the library for our mental stimulation. Our diet, certainly if we're eating a healthy meal with a group of friends, we're combining, these lifestyle choices. And so you don't have to think about setting up a whole new work plan for getting through your day to make sure you've tackled every one of these elements in isolation. They happen together very, very frequently. So mental and social stimulation are really important. I wanted to talk about sort of 5 really key points that came out of the conference. And I want to make sure I get the numbers right on this, but what they talked about was these lifestyle factors like not smoking and exercising regularly and having a healthy diet and getting adequate sleep and staying mentally engaged or socially engaged. Managing any of your metabolic or vascular problems like blood pressure, diabetes, obesity. These are all things that if you can work on 4 or 5 of those, you can reduce your risk of Alzheimer's dementia by 60%, as opposed to people who don't make any effort on those lifestyle factors or that they only do one of them. So again, the idea is the more you're doing for your brain, the better. And so the fact that we can reduce the risk of Alzheimer's dementia by 60% by implementing these lifestyle factors is really, really exciting and very, very important news. Adherence to the healthy lifestyle may counteract the genetic risk for Alzheimer's disease. That's really important too, because a lot of people have said, it's in my family, there's nothing I can do about it. But the reality is they actually can. And so these studies are showing that we may be able to reduce our risk. Having a higher cognitive reserve built through formal education and cognitive stimulation can benefit the aging brain by reducing the risk of dementia among people who were exposed to high levels of air pollution. That was a really interesting study that came out as well. So this idea of brain reserve and cognitive stimulation and so on can counteract some of the negative things like air pollution. Confirmation, we also got confirmation at this conference that early adult to midlife smoking can be associated with cognitive impairment as early as when people are in their 40s. So again, it's one of those things that if you are smoking, talk to your doctor about this. And we do know that it's one of those modifiable risk factors. And then alcohol use disorder or drinking too much can significantly increase the risk of dementia in older women. So this was another study that they talked about as well. So some diets that are out there talk about, a moderate or small amount of alcohol being safe or beneficial to the brain, but this study is saying too much alcohol increases the risk of dementia in women later in life. So again, we want to be modifying this and making sure that we're using safe levels and so on. And while there's a lot of debate over perspectives and areas of focus and terminology, it was good scientific debate that was going on. One thing that everybody agreed on was that we have to be looking at this condition much, much earlier than we are now. That rather than waiting for signs of memory loss or language problems or thinking issue, cognitive problems, we need to be looking at our lifestyle choices much, much earlier and picking up on some of these healthy habits and so on. To that end, there was a study about a program called My Brain Robbie, and this was actually aimed at school-age children and teaching them to adopt healthy lifestyle choices. And the interesting thing was the kids were taking the information home to their parents and then helping the parents make healthier choices as well. So really interesting study and looking at aiming this information at kids in a child-friendly, appropriate way, of course. So to get them really excited about brain health. The other thing that this really shows is that you're really never too young to start these brain healthy habits and so on, but also important to know that it's never too late to start them either. That making some of these healthy choices can impact not just your risk of developing cognition, but it may slow cognition loss or cognitive loss if you do have a sort of mild cognitive impairment or something like that. But beyond that too, there are other benefits that people may be experiencing from increasing their exercise or eating a healthier diet and so on. So lots of great information out of this conference. This was just a piece really about lifestyle because that was really very novel and exciting news. And I'm thrilled to have been able to share it with you. And I thank you very much for your time and your attention. Oh, there's a question. Okay, so this was a question about trying to get somebody to slow down. I think that they may be overextending themselves was the sense I got from the text. And by that, they're getting themselves run down and ending up in the emergency room and so on. Well, there are certainly different ways to go about doing that. I'm not sure if this is a patient, somebody that maybe has some cognitive challenges to begin with, or if this is just a question in general. But depending on the person and your relationship with them, maybe it's a matter of sitting down and saying, okay, we've had 3 incidents in the last year. This isn't healthy for you, and it's difficult for me to watch. What can we change to avoid the emergency room visits and so on? I encourage the person that sent that question in to either email me or something so that we can make sure that she gets the right answer, that she's getting exactly what she was hoping to get. So without any more information, it's a little hard for me to offer suggestions. But again, I thank everybody for your time and attention, and I look forward to another Facebook Live with you. Thank you.